Eyelid surgery really sort of can be split into three kind of categories. You can do the upper eyelids or upper blepharoplasty, the lower eyelids or lower blepharoplasty, or both, which can be done at the same time. When talking about the upper eyelid surgery, we're typically talking about just removing, it's typically a skin-only procedure, kind of taking a borderline crescent-shaped amount of skin from the upper eyelids. There are times that patients can have a little bit of puffiness on the inner part of the eyes that can be reduced at the same time. That's a procedure that I can do in the office just with numbing medicine in the skin or local anesthesia, and it leads to usually around a 2-week recovery. When talking about the lower eyelids, that's typically can be either fat pads that can be reduced. There can be excess skin, which is removed by an incision that's just beneath the eyelashes, and that can help to pull up some of the excess skin. Or there are many cases where it's both, where it's some fat removal as well as skin removal. If those procedures are done together, upper and lower eyelids, I certainly do it in the operating room, and even just the lower eyelids, I do that in the operating room as well. Recovery from lower eyelid surgery is a little bit more involved than the upper eyelid, but typically is still, again, around the 2-week mark. Patients are certainly socially presentable. The main difference between the recovery of the lower eyelid surgery versus the upper, the lower is a little bit more involved. Typically, if fat removal is recommended, the actual incision for that part of the procedure is actually made inside the eyelid, where the kind of the pink part of the eye. By pulling the eyelid down, that can cause a little bit of inflammation or swelling to the inside of the eye. It can kind of leave the eyes looking just a little bit more like irritated for usually maybe a week or so.